Specifically with the shoulder, there's multiple different problems that can present, and there's multiple different solutions outside of the traditional non-operative treatment, which is anti-inflammatory medicines, physical therapy, and cortisone shots. Choosing the right procedure takes, number one, the ability to provide that procedure, and the patient's understanding is what of the risks and benefits of each. That's something that has to be discussed with the patient and evaluated with respect to the risk of surgery, the length of recovery, and the durability of that procedure. In some patients, that's arthroscopic surgery. In some cases, that's surgery typically that's open when you're looking right at the anatomy. In other patients, that's shoulder reconstruction with a typical conventional shoulder replacement or a reverse shoulder replacement. If you cannot provide all those services, it makes it difficult to allow the patient to choose what's best for them. Here at Signature, we have shoulder surgeons that can provide all those services, and therefore the best procedure for the right problem for the right patient will be selected. Specifically, the way that I practice is very much shared decision making. Typically, when you'll come to see me, I'll assess your complaint, provide physical examination to hone in on a diagnosis, and then present multiple options. And I often tell my patients that I'm not the one that makes the decision to have surgery or to undertake physical therapy. I provide the options and the understanding and the risks and benefits of each and allow the patient to make a decision. The good thing about shoulder surgery is that typically those are not acute decisions that can't be undone. In orthopedics, we can provide the menu of options for the patient, and they're the ones who typically will tell us exactly how much treatment they want, how quickly, and what best fits the outcome that they're trying to achieve.